Let's say we are part of a sports team training a few kids to play football, and one of the kids develops a sudden muscle pull in the back thigh. With some background knowledge, you immediately stop him from playing and ask him to apply ice. You allow him to rest and to plan to restart the training after a few days. As a coach, trainer, therapist, how do you decide if he is fit to restart training and be sure that he may not get re injured again? If you are looking for answers to these questions, you are in the right place. Welcome to the lecture on overview of phases of rehabilitation with me, Wing Commander Dr. Chandrasekhar Guru. I am a sports medicine specialist, associate professor in the field with the Department of Sports Medicine, Armed Forces Medical College, Pune. So in this lecture, you will learn what are the rehabilitation principles, how to define the aims and goals of the sports rehabilitation, to understand the principles of tissue healing and correlate them with the injury rehabilitation model. What are the different phases of rehabilitation, to describe the phases and to also discuss various sport specific aspects during the different phases. We also would learn about certain practical aspects while implementing the rehabilitation phases in terms of discussing various key factors that influence the outcome and what kind of impact they have in the outcome of the sports rehab. Coming to the aims and goals of rehabilitation, the sole aim of a sports rehabilitation program is to get back the injured athlete to sports safely and timely. So, in order to achieve this overall aim of getting the athlete back to a pre injury status and participate in sports, we have certain goals. The first and foremost goal is arrest further damage to tissues immediately and address the impairment. Restore the strength and function, and a step ahead would be in terms of restoring the performance to the pre injury level. Then you also need to prevent or minimize the risk of re-injury that can happen uh, after participation, after returning back to sports. So in order to apply these goals, it is important that we understand what is the physiological process, how our body responds to an injury and how it heals the injury. So the principles of tissue healing is very important. Say, let's take an example where an individual has sustained an injury and the body has started responding over a period of multiple days. So we divide this response into three different phases. The first initial phase immediately after injury is called as the stage of inflammation, wherein the body immediately responds to this insult or injury, and thereafter you will find sudden increase in the blood flow, wherein a lot of blood cells arrive at the spot and then start secreting various chemicals which kind of initiate the process of repair, wherein you will find a lot of chemicals being secreted in the area of injured site, and this generally lasts for a period of 3 to say roughly 7 days. So this is the range, which depends basically on the extent of injury and the tissue that is being injured. So various other factors determine this duration. Subsequently, uh, it progresses to the next phase, but it is important to also understand what actually is the cardinal signs of the stage of inflammation. The stage of inflammation is actually identified by 5 cardinal signs of inflammation, which we generally refer to as the Ruber, tumor, Calor, Dollar, and Functionalesa, which is nothing but appearance of redness, there will be swelling, there will be increase in the temperature, there will be pain, and also because of these problems, there will be loss of function. The individual may try to protect that injured part, so the function is also affected. These are called the cardinal signs of inflammation, which is specific to this first phase of inflammation. Subsequently, as the cell starts to lay down various tissues, new freshly made tissues on the injured site, trying to address the gap that has been created by the injury. So that is the stage of proliferation, wherein there are certain group of cells which starts laying down the collagen layers. So thereby over a period of time you will find the gap to get closed. There is approximation of the injured area, and that is called as the phase of proliferation. Generally, it depends on the extent of the injury. As I said, if it is a small injury, it is within say 4 5 days only the phase starts. But if it is a slightly bigger injury, or if it involves a deeper tissue or the bone, then it extends to a period of up to 3 weeks or so. Beyond that, it is not during this phase the tissue is laid down. This tissue is called as the granulation tissue. This particular tissue is still not very strong as it was before. So this is still fragile, and as the proliferation phase comes to an end, the realignment of the laid over collagen fibers happens. The collagen fibers are arranged in a specific arrangement, so that the force production is kind of maintained. So that kind of remodeling of the newly laid down collagen happens during this third phase, that is the remodeling phase. It generally starts beyond 3 weeks, and then it continues depending on the extent and the type of the tissue that is involved. It may extend even up to years in case of bones. So how do we correlate this? You have now understood different three phases of tissue healing. How do we correlate it and apply it in terms of sports rehabilitations? It is important to align your rehabilitation goals along with this process of tissue healing. So there are the first three phases. The first phase, as we say, it is aligned with the inflammation, is called as the phase 1 or the acute phase, wherein the main goal here is to prevent further damage. Because an injury has happened, we want to arrest that at that stage and avoid further damage. And then also in this phase, the main emphasis is on addressing the impairment and the function loss that has happened. So how do you address this? That is called the phase 1 of rehabilitation. Subsequently, as the days pass by, move on to the proliferation phase. Here you kind of go on to a goal of restoring the function, initially in terms of the range of motion, gradually to the strength, coordination and flexibility, which has been limited because of the impairment that has happened during the injury phase. And subsequently, once the basic strength is gained, then you progress into something called as advanced strengthening phase and try to return the individual to sport, back to the pre-injury level. But then the main aspect in this particular phase 3 is to addressing to the strength, and also to mainly addressing on to the sport specific drills, which are key components of phase 3. But then unique thing about the sports rehabilitation is adding a last phase called as phase 4, wherein the return to sport is not the final terminal point end point, wherein you have to further introduce something called as long-term injury prevention program. If that is introduced, that will kind of reduce the chance of re-injury in that particular athlete because of participation in sports. So hence it is important to always incorporate this re-injury prevention phase at the end of the return to sports phase. So having known the various phases of inflammation, it is important that we need to have specific target in each and every phase. So moving on with that, with phase 1, as I mentioned, in phase 1 we have the acute phase, where the signs of inflammation is very prominent. And in such a scenario, it is important that we control these signs of inflammation so that the individual can feel better and progress to the next stage. The main important aspect that one has to target is the pain control. So as we saw, one of the signs of inflammation is pain, and the other important aspect is the swelling. When pain and swelling are there, they inhibit, as a protective response, the body tries to kind of control or inhibit the movement that can happen along the injured side. So the muscle around the injured area is also kind of inhibited. It is not activated easily. So this causes an kind of impairment in the local region. So there is lack of movement also in the local area. So the main target would be to control this pain and then try to increase the range of motion. So you initially can start with passively help the individual complete assistance and then do a passive range of motion. And once the individual is able to do within the pain free range, gradually you can give an assisted active range of motion and progress it to an active range of motion in the pain-free region. So that's how the main focus here would be to control the pain and then address the movement deficit that is there in the around the region of injured area. The subsequent focus in this also would be to address the what you call as the motor control. So whenever the injury happens, the sensory receptors around the joint and the injured area are also damaged. So that also gives a false input whenever you do a motor execution. So it is important that during this phase you start initially the basic activation of this receptors in terms of proprioception or giving a joint stability. So that helps in further developing onto the motor control subsequently. And the third important is the muscle strength. As I said, because of the pain and the swelling, the muscle around the injured areas are inhibited. So it is important to focus on activating these muscles around that, so that subsequently it will help in further strengthening aspect as well. So the exercise therapy that is limited in this region or this phase would be more or less a controlled kind of exercise therapy, so that you should also cause or introduce a certain amount of movement, but the main emphasis is on protecting the injured area so that you don't cause further damage to the injured area. So that's the target that we have in phase 1. Moving on to phase 2. Phase 2, if you see, as shown in this figure, the control of pain and the range of motion is maintained. So the focus is still there only, but then you further progress the range and then you increase the range to a next level, so that the goal here should be to reach at least full range, or not possible at least to the near full range as to be achieved during this particular phase 2. More emphasis is given on motor control in terms of balance, proprioception and stability. If the motor control of a particular sports, for example football, this case of football involves a lot of agility deviations and a lot of side cutting maneuvers and landing techniques. So in this phase, if you are looking at motor control, break those complex into small uh, simple movements, and then those movements can be practiced in this phase, so that the activation of the neural pathway is done and it helps in further building up of the complex movement subsequently. And emphasis also given on building up the strength, because as we discussed, the main focus is also to restore the function. So restoring the function of even activities of daily living is important, because that boosts the confidence as well. So imagine a condition wherein you find it difficult even to remove your t-shirt, having a shoulder pain. So that gives a lot of mental or psychological setback in terms of continuing with the exercise program. So it is important that you restore the function even at the level of activities of daily living will boost the confidence level. Subsequently, when we move on to phase 3, now with the individual having been able to do the activities of daily living with minimal kind of discomfort, it becomes easier to progress to the next level because of achievement of certain level of basic strength. So here you think about moving on to sport specific drills, addressing the pain control is still there. The pain, however, which is initially say around 8 or 9 out of a total score of 10 in the first phase, can gradually come down to 6 to 7, and then in phase 3 it may come even down to 3 to 4. So 3 to 4 on a scale of 10 is okay enough to progress with the strengthening aspect. However, the function or the main aim or the target should be to further reduce the pain and make the individual completely pain free, so that the individual is able to further carry on with the strengthening aspect as well. And the range of motion has to be full even with the loading aspect. So that is when you will be able to efficiently increase the strength of the particular structure and the muscle groups around the injured area. Motor control, yes, the balance, proprioception, stability. In addition to that, you increase sport specific drills in terms of agility, like fast shuttles can be introduced. You can have various other sport specific drills that can help in kind of achieving this particular complex movement in the sports. The key aspect or the target in phase 3 would be to moving on to advanced strengthening. You have already reached the level of basic strength, Now you build upon that using various eccentric activity to increase the maximum strength and the power. The exercise therapy is mainly focused or progress from a control level to more of a complex sport specific level. When we move on to the final phase 4, wherein the individual is already been at a level where he can be participating in the sports. However, the participation can happen only with the clearance of certain tests. And here again you also focus on the pain and the range of motion, because it should be the focus on all the 4 phases, wherein achieving a full range of motion with no pain would be the end target of phase 4. And motor control obviously to have a better technique as well. So if there is a technical flaw which could have been identified during the phase of rehabilitation, can also be addressed and then incorporated in the injury prevention program. Further, you also go on to advanced level of muscle strength training like eccentric training or a plyometric training can be added to make more of a sport specific power gain. The exercise therapy mainly focuses on including all those corrective measures in the daily sports training program, so that it becomes part of the individual's training cycle, so that will reduce the risk of having a re-injury again. So, having known a broad aspect of all the phases of sports rehabilitation, let's go somewhat in detail about each phases of this sports rehabilitation. So, moving on to phase 1. Phase 1's main goal, as we discussed, is to arrest damage. How do you arrest it? So, it is by following a simple protocol called PRICE, which was earlier claimed to be the small acronym which includes P for protection, R for relative rest, I for ice, C for applying compression around the injured area, and E for elevation. So, following these aspects immediately on the field, immediately of the injury, is found to reduce the kind of secondary damage that can happen because of the injury or the ischemic changes that can happen subsequently. So, it is important to follow that. Now, the thought process, the contemporary thought process has moved from giving relative rest to the injured area to something called as optimum loading. So, R is now replaced by OL. So, that is why it becomes a police protocol, wherein it no more it is kind of a complete or a relative rest that is advised to the region. It is it has been found that even if you have some amount of optimum loading, low level load given to that region, helps in kind of mobilizing the part or reducing the swelling and further preventing the damage. It also helps in faster recovery and healing. So, it is important to follow this police protocol. Also, you need to understand, as we discussed earlier, during this first phase, the tissue that is being laid down as a repair tissue is very fragile and it can again get damaged easily. So, it is important that it should not be stressed upon. So, what you can do is we can kind of try to de-stress this or transfer the load by following certain simple biomechanical measures. The other important aspect in the phase of acute stage is that we discussed about the impairment that the acute inflammation causes, and then because of which there is a lot of limitation in terms of the movement. So, the focus is also to focus on activation of the muscles which are impaired around the joint or around the injured area, and then try to increase the range of motion by reducing the swelling, reducing the pain itself, pain control, and also by increasing the mobility by either passive mobilization or active assisted in this stage. The end stage of acute phase of rehabilitation will be to try to restore the movement to a basic necessary level. Say, I will give an example. We have an example of an ACL injury which has been operated and the individual is in day 1 of surgery. So, you should have realistic goal of, say, during this phase to have kind of achieving reduction in the swelling as well as to increase the range of motion to at least say extension of close to 0 degrees and flexion of at least 90 degrees by the end of phase 1. So, towards that you will start working towards that slowly and gradually, so that by the end of the acute phase you are able to have a achieved this 0 degrees of extension and a 90 degrees of flexion at least by the end of phase 1. So, that should be the kind of optimal dosage that one can take during this phase, so that it kind of gives you an extra edge in terms of increasing the recovery, but also at the same time prevents further damage to the newly formed tissue around the injured area. So that's how gradually it has to be a balance between the recovery and the further damage. Moving on to the phase 2, that is subacute stage, wherein the main focus is here on motor control, balance, stability, and the proprioception. So this is very important, and the end point of subacute stage would be to reach activities of daily living, restoring function at least towards the activities of daily living with minimal discomfort. I'm not saying that it should be completely free of pain, the activities of daily living, but then there should be clinical improvement in terms of the restorement of the function in activities of daily living. So that is very important, the key focus being on the proprioception. So it is important to introduce certain simple proprioceptive methods, like I would say here in example of an ankle injury. So by phase 2 you should also incorporate certain balance techniques also in the program, wherein you can ask the individual to stand on single leg with partial weight bearing, at least to feel the movement or the position of the joint. So that kind of helps to progress subsequently in a way that you can progress it to a complex kind of movement execution. Restoring activities of daily living, as we discussed, it's very important because restoring the individual to a level of activities of daily living will tremendously boost the confidence in adherence to the protocol and kind of improve the morale of that particular injured athlete. Hence it is important to achieve this. The exercise therapy is mainly focused on improving the range to the end range and activating the group of muscles and have a certain amount of basic strength, so that the activities of daily living is possible. And predominantly the strength training involves here in terms of isometric, just by increasing the pressure without any change in the length of the muscle fiber. So that is found to also reduce the pain as well. The third phase would be return to sport. Once the individual is able to carry out certain, you have restored a function and is able to carry out certain aspects of activities of daily living, you progress to something called as the return to sport. Now the individual is ready to take on further strength in terms of improving the advanced strengthening activities, as well as to increase the sport specific drills. And you can also set certain objective functional tests to ensure that the individual has achieved a certain level of fitness to take part in the sport again. So the developing strength here would involve progressing from isometric kind of a type of strengthening program to isotonic in terms of concentric, and subsequently towards the end into eccentric kind of strengthening activities. The activities also should include should simulate certain exercise therapies which are simulating the sport specific activities, so that the individual, when he goes back to the sport, the neural pathway is already also triggered, so it is easier for further strengthening this activity. Incorporation of sport specific drills again is very important in this phase, and the progression should be criteria based. You should have specific tests. For example, in case of a knee injury, when the individual reaches phase 3, how do you decide that individual can go back to sport? So you do a single leg hop test and compare with the uninjured limb. So you get to know what is the compensation, or what is the achievement of the level of power and the distance that the individual is able to hop can be identified. So that gives a objective way of progression. The last phase is the prevention of re-injury. This again is very important because here re-injury, the single most important scientifically proven factor is the past history of injury. Whenever an individual has an injury, he is more prone to again get predisposed to frequent recurrences. So it is important to address this as part of the sports rehabilitation itself. In this phase, you need to understand what are the risk factors that would have led to the occurrence of the injury and try to address them. This is a good opportunity to correct the technique during this particular aspect, and then incorporate that into your program. Say if in the case of an ankle sprain, it is seen that the chances of 50% of recurrence is there in the initial 1 year of injury. So it is important that you institute a program with balance and proprioception for neuromuscular coordination of the entire lower limb segment, and also to include a protective in terms of ankle trap to give a proprioceptive signal to the brain. So that kind of a program has to be instituted as part of the daily training cycle, so that it becomes part and parcel of that individual sports training program. So as we come on to the practical aspects in implementing this, the first aspect is the athlete, because the sports rehabilitation is athlete oriented. So athlete is the center of the entire gamut of things that we are discussing. So it should be more of an informed decision making in consultation with the athlete. The kind of rehabilitation program depends on the level of athlete. Professional athlete, obviously they are in the peak of the career, they want to go back to the sport as early as possible. So that's why we have a lot of accelerated protocols. So then you have time based structured program, and the adherence level is also good because of the availability and access to the resources. Individually, we have to understand that everybody and every body is different, so the response to the rehabilitation program may be different. So it is important to give the due regards to that particular aspect in terms of the athlete. The second important crucial role in a successful sports rehabilitation is the involvement of the coach or the trainer. It is a collaborative approach. The timelines have to be fixed by the therapist and the sports physician team in concern with the coach and the trainer, so that the next level, next competition that has been planned accordingly, your timelines of various progression also can be designed accordingly, and also the criteria based progression. So if you involve the coach and the trainer, you can get good sports specific kind of advice in terms of clearing to the next particular phase of rehabilitation. Most vital in the entire gamut of sports rehabilitation is nutrition, because athletes tend to gain weight because of reduction in the physical activity level. So it is important to give them nutritional counseling, same time not to gain weight but then increase the muscle mass, and then try to have a good weight management program during the process of rehabilitation. As we discussed, any kind of injury is a major setback for an athlete, because the athlete derives the pleasure and the kind of kick by participating in the activity. Now because of the injury, it is a setback and it creates a lot of emotional response. So it is important to educate the athlete, give the athlete the correct information about the duration that it's going to take, promote that kind of mental training sessions, so that the individual becomes more positive and gain more confidence over the period of sports rehabilitation. And the final aspect is the adherence, because adherence is important for a successful rehabilitation outcome. So it depends depending on the athlete level also, as we discussed. If it's an high performance athlete, obviously that's going to be the main source of living. So the individual is more focused, the adherence is there mostly towards 100. Whereas in recreational, they will be balancing their sporting passion as well as with the work or education. So it is important that the therapy or the sports rehabilitation program is tailored towards the need of the athlete and the type of athlete. And hence therapist plays a major role in kind of designing the entire sports rehabilitation program. So how can we increase the adherence level? It's by using technology. So a simple incorporation of, say, a notification sent to the individual to as a reminder to do a particular set of, will improve the adherence level of the individual. Thus the entire gamut is a team approach, where you start with prevention of further damage by using a police or a price protocol, modify the activity to unload the stress on the injured area, focus mainly on pain modulation and the range of motion, gradually go on to gain the restorement of function in activities of daily living, and thereafter to sport specific drills. Control from a controlled therapeutic exercise to a more of a complex sport specific exercise should be instituted. Finally, also incorporating the long term injury prevention model into the sports rehab. So the entire gamut is go side by side along with the psychological support, nutritional and biomechanical support, and hence it's a more of a team approach with complete social support of the coach and the administrator. So this lecture finally, to summarize at the end of this lecture, is that rehabilitation must follow the principles of inflammation and tissue healing. The more you align with this, the better will be the outcome. Sports rehabilitation mainly focuses, the unique thing about sports rehabilitation is that it focuses on the movement pattern. It is given importance right from phase 1 onwards, and technique correction and biomechanical correction will help in further kind of reduction in the chances of re-injury. It is important to address the impairments and the limitation that as the individual has sustained because of the injury to avoid re-injury as well. A objectively structured and a realistic rehabilitation program is bound to give a better outcome, and it is always important to incorporate the long-term injury prevention program in sports training. So for those of you who are interested in further in-depth learning, these are the references. Thank you and Jai Hind.